Knock, knock. Hi there, my name is Anna. I'm going to be your nurse. How are you doing today?
Good, thank you.
Good. I'm just going to start by doing some hand hygiene and providing us with some privacy and comfort. Are you comfortable?
Mm-hmm.
Good. Okay. I'm just going to start by checking your wristband. Can you confirm with me your name and date of birth?
Olivia Polker, 7/12/02.
Great. Okay. I'm going to ask you just a few questions. Well, first I'm going to be doing a neuro assessment on you today, okay? So I'm just going to have you do some different tasks for me. Does that sound okay?
Mm-hmm.
Great. And then I'm going to ask you a few questions. Do you know where we are today?
The hospital.
Yes. And why are we here?
Neuro assessment.
Yes. And then what month is it?
February.
Great. Do you have any allergies I need to be made aware of?
No.
No? Okay. And then are you in any pain today on a scale from 0 to 10, 10 being the worst?
0.
Great. Okay. Patient looks to have good posture, good hygiene, the age that she stated, is well dressed, and does not have any outward illnesses that I would need to attend to before doing my assessment. So to get started, I'm just going to start assessing some of your cranial nerves. Okay, so cranial nerve 5 is going to be the first one I'm going to assess, and so that is also the trigeminal nerve. So what I'm going to do is I'm going to have you clench your teeth. And again. Great. Okay. And the next thing I'm going to do is I'm going to take my light, and what I'm going to do is I'm going to touch some different places on your face. Have your eyes closed, and you're just going to tell me where I'm touching, okay? I'm just going to close your eyes for me.
Left forehead. Right cheek. Or chin, cheek. Left cheek. Right forehead. Left cheek, chin area. Sorry. Right cheek.
Great. Okay. So patient has good function of the cranial nerve 5. Next, I'm going to assess cranial nerve 7, which is the facial nerve. So for this one, I'm going to have you take your eyebrows and have them go, you bring your eyebrows up, bring them down. Great. And then smile for me. Frown. Okay. And then puff your cheeks. Good. That's great. All right. So next, I'm going to do assess for perla. Okay. So now you just look right straight at me. Okay. And I'm going to. Great. So next I'm going to do accommodation. So you're just going to look at my pen light, and I'm just going to bring it closer to your face. Don't move your head or anything, just follow the light. Great. Patient has good accommodation, and I would rate your pupils at about a 3. 3 to 5 is normal. Your eyes are also set evenly at the same spot. They're symmetrical and even, so that is good. Next I'm going to assess your cranial nerves 3 and 4, your ocular motor, and your trochlear nerves. So I'm going to be doing this by doing the EOM assessment.
Okay.
So you're just going to keep your head straight. You're not going to move your head at all. You're just going to follow my pen light in the different spots that I move it, okay? So I'm going to start here. Great. So based on that assessment, those cranial nerves would be intact. Next thing I'm going to do is I'm going to test for bilateral grip strength. So I'm going to have you just grip my fingers with both your hands. Great. Patient has equal grip strength in both hands. Next, finger coordination is what we're going to test. So I'm going to have you do this. Touch fingers to your thumbs. Great. Patient has good finger coordination. And then I'm going to test your fine motor function. So I'm going to have you touch my finger, touch your nose on the other side. Great. Okay, so now that we've done that, I'm going to have you lay back. I'm just going to pull this out. You can put your feet down. Great. So I'm going to test your bilateral feet tone and strength. So what I'm going to do is I'm going to have you push back on. Great. Yep. And then pull back now. Great. Patient has good bilateral feet tone and strength. So next I'm going to have you take your, I just touched your feet. You're going to press your hand against, you're facing against my hand, great. On the other side, this is testing for spine or cranial nerve 8 or 11, which is the spinal nerve. So next I'm going to have you stand up for me. Great, and this is also testing for cranial nerve 11. I'm going to have you, you can just bend over for me, touch your toes if you can. Great, so I'm just assessing the symmetry of this, the back. Her shoulders are set at the same place. Her hips, I don't see any curvatures of the spine that would indicate any kind of scoliosis or anything like that. So you can turn back around, and I'm gonna have you test your, your lower limb coordination. So I'm gonna have you take your heel and touch it to your shin, bring it down. Great. On the other side. Awesome. I'm gonna do a Romberg test now. So what I'm gonna have you do is stand shoulder width apart, hands at your side, look straight ahead, close your eyes. Great, just stand there. So I'm assessing for the patient's posture, mobility, balance, and stability. And I don't see any abnormal swaying or anything that would indicate that this patient is having any kind of problems. This is testing the cerebellum function. So that all looks good. So you can sit back down now. Okay, so now I'm going to test your deep tendon reflexes. So I'm going to first test your bicep. So you're just going to lay your hand right here. Actually, can you flex for me? Great, okay. Great, I would rate this one at a 2. I'm going to do this side. Flex for me. Okay. I'll rate that at about a 2 as well. Next I'm going to do the knees, or the patellar reflex. Okay. I'll rate that about a 2. And on this side. Let's see. Yep. I would rate that a 4. So next, I'm just over, now that I've finished my assessment, I would say that the patient has a glaucoma scale of 15. She was responding to my visual, she was verbally responding to me. Her eyes were completely oriented throughout the whole time, spontaneously, and she was able to follow different motor functioning tasks that I gave her. So that would be the end of my assessment. I would document my findings. And do you have any questions? Okay, great. Thank you.